IT&E and Calvo Enterprises. We now go back to the KUAM Zoom room, where Hospital Administrator Lillian Posadas is standing by with our morning update. Lillian, there's a couple other things we wanted to share and talk to you about. There were some great Facebook posts from some of the exiting medical staff that came to the island to assist with the COVID response. We'll get to those, but first, if we could get to just the COVID census at the Guam Memorial Hospital this morning.
Okay. We are at, good morning, Guam.
Morning.
We are at 176 total patients, both COVID and non-COVID. But for COVID, we have 83 patients in the house who have COVID conditions. And of the 83, 12 of them are deemed ICU level of care. And of the 12, 5 of them are on ventilator support. We do have 10 individuals up at the CIF. That's our COVID isolation facility, which is really the skilled nursing facility in Barra Grande Heights. So that's where we stand right now in terms of our COVID census.
Have we had any deaths this morning or any deaths at all since the last ones that were reported?
No, not since yesterday. None through the night, and I haven't heard any as of this morning.
And just to clarify, because we had Congressman San Nicolas on early this morning, he had shared with us that he is at the Guam Memorial Hospital. Are you able to tell us, is he in a COVID ward, non-COVID ward, or is there anything else you can share about his status, of course, without violating HIPAA or anything?
I know. I can't say much. He is here in the hospital, and his condition is stable. And, yes, he is with the other inpatients who are in the house with COVID condition. So we're maintaining, yes.
I'm sorry. So he's in one of the COVID cares units?
Yes, ma'am. Uh-huh.
Was he swabbed upon admission, and are you able to share that result with us?
I don't have that information.
Okay.
I'm certain that he was swabbed, because that's, our protocol is that they get swabbed.
Yeah.
Mm-hmm.
What about the status of the, we saw the pictures, the beds out in the parking lot. We spoke to you just yesterday, I believe, about the tents. Can you give us an update? Has anything changed since yesterday?
Well, we've moved the warrior tent that was out in front of the ER next to there were 2 warrior tents in front of the ER. And so the one that the Guam Fire Department, we allow them to use for decontamination, that warrior tent, we moved it over to the courtyard area right next to the Z-Wing. That front building that has been condemned and not being used, and we're in the process of trying to get that wing demolished. So to the side of that wing in the courtyard area, that's where that warrior tent got moved to. So the GFD will continue to use it to decontaminate. The second warrior tent that's still there in front of the ER, our plan is to replace that with a Blue Met tent, because the Blue Met tent has a capacity for negative air pressure. And so, once we get the Blue Met tents from, I guess when it's all cleared by customs, we will get 2. So one will be stationed right outside of the ER, kind of like over the overhang. So there's that protection from the rain and the wind, giving it a little bit more, protection from the wind. And if we need to move patients from that Blue Met tent into the facility, into the building, it's pretty much covered and rain will not hit the patient. So that's the plan, is that Blue Met tent that has a capacity of 10 beds. We're going to use that for COVID patients who come through the ER. The second Blue Met tent that as soon as we get it, we're going to install it and base it in the doctor's parking lot, where it has, it's kind of like an underground, but it's open in the Bay Area. That's where we're going to station that second Blue Met tent, again, for COVID patients who are kind of like low level and, transitioning between the acute to the SIF or to home.
You mentioned.
So
Go ahead.
Go ahead.
No, I was going to ask about the tents that are currently up. You mentioned the warrior tent. Are you going to have to take any of them down with this tropical storm watch that's been issued for Guam?
We're gonna take the if we get as soon as we get the Bloom at 10, and we're hoping we get it today and we get it installed. We will take down the Warrior tent. Yes, absolutely.
Because because the Blue Med tent is able to withstand the winds that a tropical storm would bring.
Right. Plus, it will be under that overhang.
Yeah.
Outside of ER, so there's a little bit more protection there. Yes.
Okay. Okay. I did also want to give you the opportunity, if you wanted to speak or give a comment on it, because we did get the release from NAVFAC Marianas this morning about the work that was done in conjunction with the federal government and the local government to make some improvements over at GMH.
Correct. Yes. We're really very, very grateful, very appreciative of the work that the NAFMAC and the NAFAC and the U.S. Army Corps with the contractor. I forgot the name of the contractor.
Hanson Phelps.
It helps. Yeah. So they did an awesome job, augmenting and enhancing the electrical sources, the electrical circuitry on in Care 3, that's the 4th floor, and Care 4, where we house, the COVID patients. And so we now have the capability to, if a patient is on a ventilator and needs hemodialysis, we can keep that patient in those rooms without having to move them, to another area so that they can get their dialysis while they're on a ventilator. And if the patient, condition also then, gets upgraded to an ICU level of care, we can keep those patients there in those units. And so they've completed the electrical and the mechanical mission project that we had requested. And so they did a great job. And so, again, it just enhanced the safe environment for these patients and for the staff. So they did a really great job with that. Now we're in our conference call yesterday with FEMA and HHS, they approved our request for electrical augmentation in the Care 2 unit, because again, we're limited. We cannot, if a COVID patient is in there, receiving ICU level of care and on ventilator, and the patient needs to be on dialysis, needs to get dialysis treatment, we have to move the patient to another area again for dialysis. So with this request from the Army Corps, they're going to be here, I believe, if not today, then this weekend, to do an assessment of what needs to be done to then augment and upgrade the electrical circuitry system in that care unit. So once we get that done, we will definitely have a full-fledged ICU unit in that Care 2 for patients who need hemodialysis treatment.
Right.
Wow.
And they completed the other project 10 days ahead of schedule, and now you're jumping right into another one. Yeah. And just to see the testimony and the posts on social media that no matter the challenges that are confronted at the Guam Memorial Hospital, you guys are just
we really, yes, and it's kudos and to our team here, the nursing staff, all the staff. Yeah. Everybody.
Let me share this, Lillian, because there was a couple posts that I saw that this really, and this one coming from Michael Swizzle, who was, a part of the group that came here to assist at the Guam Memorial Hospital with the COVID response. He posts on his Instagram, "I'm so sad to be leaving Guam. This has been one of the greatest experiences of my life, filled with highs and lows on the backdrop of true paradise. Thank you all so very much for allowing me to work together on your team. I appreciate from the bottom of my heart how you all work so hard to make me feel like a member of the team from day one. Not only do you practice excellent medicine here at GMH, but you do so with ferocity and passion for fixing your patients against what seems at times like insurmountable odds. You keep fighting day after day for weeks on end. Furthermore, this is not just a single person or group. This starts at the operator, who always cheerily answers the phone. Half a day, how can I help you, doc? To the overworked facilities management team, the proning team, our wonderful and compassionate nurses, pharmacists who keep me on track, our incredible hospitalist team. I hope that my small contribution of time and effort can do some good. You're putting your very lives on the line in the face of the worst disease our generation has ever seen. You are true heroes. I will definitely be singing the praises of GMH when I return home to Washington State. And I will miss you all so much. I feel so unbelievably lucky to have friends that make saying goodbye so difficult. I hope to see you soon, and please visit when you come to Seattle. There was also another one, Bree.
This one is Raina Lynn. She had posted, now that I've had some time to reflect on my experience in Guam and I've shared some of the adventures we were able to go on in between our crazy shifts, here's what we did here. Let me start off with these nurses, pharmacists, doctors, and respiratory therapists at Guam Memorial. They are the kindest, most compassionate, caring, intelligent, badass medical professionals I have ever worked with. They worked their butts off to do everything we could to keep these patients alive with minimal resources. As one of the doctors said to us, now you know what it's like to do everything with nothing. So thank you, GMH, for welcoming us into your family and everything you have taught me along the way.
There was another one here, Lillian, from Ryan. Ryan Cogdill wrote, last night was my last shift here on Guam. I don't know what I was getting into when I signed a contract to work here, but I'm sure glad I did. Even though the hospital runs out of supplies, the resources are very limited, and the patients are pretty sick, I feel that I've grown so much on a professional and personal level. The patients are truly grateful for the care that you provide and treat every medical professional with the utmost respect, often referring to me as Sir Ryan. Family is always at bedside here. It's rare that you see a patient dying alone, unlike the U.S. I can count on one hand how many drug-seeking patients I've had here, a huge contrast to the multiple a shift I usually have to deal with on the mainland. If we're out of gowns or snacks, yes, we do run out of gowns. Most of the patients here say, thank you for looking. In the U.S., if I were to run out of a ginger ale, all hell would break loose. Here, the staff often call the patients mama or papa and treat them as if they were their own family members. Working here reminded me of why I became a nurse, and I'm truly privileged to have opportunities to provide care to the people of Guam and the surrounding Micronesian islands. The shirt that I'm wearing says Aamti, which means healer in Chamorro, the local language, a gift for Nurses Week. Lillian, you know, it's so easy to just throw GMH under the bus, to just, you know, people out here are dividing our community by hating on this pandemic, by just doing everything they can to just sow dissent in what is at its heart a public health emergency. How does it feel to be validated by those people who come from off island, who come here, and they're all saying the same thing?
Yeah. You know, despite the criticism and the judgments, you know, our staff continue to fight this battle. And I'm sorry, but I'm breaking down because, you know, just to hear those very encouraging and inspiring feedback just validates that, you know, we're here to fight and take care of you when you come in. Yes, we're limited with beds, and yes, we're limited with resources, but, you know, we give our best. We give our heart. And it's just such a, I'm sorry, my heart is all welled up in my eyes because, you know, it's for the staff who really work hard here and risk their lives. And it's, you know, we're doing it for the people of Guam, not for anything else, but for the people of Guam. And so, you know, it was really just really great to receive that message and that feedback that, you know, what we're doing all along is the right thing and the best thing, given our limitations. And so, you know, for those who continue to criticize, you know, join us in this fight. The more we fight together, the stronger we are, and, you know, the more successful we can be in beating this COVID pandemic. And so, you know, that really is very heartwarming to hear and to receive. I'm sure that the staff.
Yep, Viva GMH.
Viva GMH and Viva Guam.
Well, Lillian,
thank you for sharing that.
Yeah,
You know what? We sent you those those comments, Auntie Lillian, and everything, so you can share with your team as well, so that they can feel what you're feeling now.
And
Right.
we
Thank
thank
you.
you know, from the bottom of
Take
our
care.
hearts.
Yeah.
Thank you.
I mean, it just makes me proud that, you know, people talk about the hospital and you know, all the issues, obviously structural, resource-wise, but to get this testimony from people who are just coming from a much better situation to come here and say that our people at that hospital are doing the best job they can and doing better in a lot of ways than their counterparts in the states who have much more to work with. So Lillian, God bless you. God bless GMH.
Yeah.
It's our people. Thank you.
All
And
right.
Take care. Stay safe.
You too,
I don't-
Happy
Lillian.
Halloween.
Happy Halloween. I don't know how you feel about virtual shrimp patty.
Sounds good.
Hey,
All
Right
right.
on. Thank you, Lillian.
All right.
Esther, be
care.
safe.
Bye-bye. Take
Yeah. 9:46. Man, that just. I told myself I wasn't going to cry anymore on this show. But.
That hurt. That to see Lillian break down like that.
Yeah.
and you know what? The one thing that we've all seen is, we know that Lillian is a very, she is a nurse with decades of experience.
Yeah.
So she knows
Yeah.
compassion, she knows medicine, she has bedside manner. But she's also through this, she's been tough as nails.
Yeah.
I mean, she has not broken, she has not lashed out when it would be the easy thing to do.
Yeah.
And just to see her be like human, I mean, that that speaks to the heart.
And I mean, when you also consider that, COVID has run through so many of her staff, I mean, and it's that's definitely, I think that's a pat on the back. I mean, we talk about COVID fatigue. I mean, you guys are tired of staying home, get a grip. But these guys are, in there trying to save your lives every day. So check
And all
yourself
they ask is for you to wear a mask.
and stay home and wash your hands and help them out. 83 people in the hospital. Come on, guys. Come on, Guam. Mungama like that, Umbi. It's 9:47. We'll take a real quick